Hey guys, welcome back to Edenic Round Table, the virtual sessions. I'm Willis, as usual, joined by my partners Rob Lewis and Jamie Del Grosso. Hi guys.
Hi.
And we're back doing these daily sessions that we're uploading every day, just trying to talk about innovation, talk about business opportunities, and spurred on really by what's going on with this COVID-19 pandemic, which is why we're running these sessions virtually, obviously, because we're all sat at home. Today's topic is health, which is the big topic. It's all over the news. You'd be hard to miss it, really, in terms of what's going on with the NHS. And obviously, naturally, there's a struggle, not just in the NHS, but across all healthcare, really, in trying to find solutions, not only to deal with the disease, but to deal with continuing in everyday life and the things that we've taken for granted for so long in terms of, pharmacies or medical appointments or whatever it might be. So what seems to be really apparent, guys, is that there's really like a heightened realization right now that health is incredibly important to us and how central it is to our everyday life. I guess it's something we've taken for granted, and now it's restricted and we're all at home. We're really starting to notice the struggle of that.
Absolutely. Yeah, I mean, I saw something today where someone is saying they don't remember the last time they actually went out and had a jog or something, but now that we're kind of on lockdown, they've gone out for one every day, and people all of a sudden being more aware of their health and their actions. Obviously, now that we're seeing the worst case scenario and this kind of extreme, it kind of, I suppose, brings us to light why we should be looking after our health.
Yeah, exactly. I mean, it's kind of akin to like a personal health scare, isn't it? On a global scale, it's making health a really sharp and focused thing. But where I live, a lot of people walk around the block, and when the weather gets better, you see more people. But today, the number of people walking past, going for bike rides, running with appropriate social distancing, I'll add, is amazing. So yeah, I mean, it's interesting to see how this will pan out in the future in terms of, will it be something that it's likely that this situation is going to last for months, if not longer. So that could actually have an interesting effect on people's health. We're already growing up with a generation of younger people who are probably more engaged in their health than ever before. And this kind of thing could reinforce that behavior.
Yeah. It's interesting, isn't it? Because, I mean, we've essentially been encouraged and taught pretty much all our lives to go out and get some fresh air, and exercise and eat healthy and all the stuff that comes across. And, for a lot of people take that quite seriously. And frankly, a lot of people don't. I think we can accept around the world. But now you're restricted and you're tied down. I think that's a good analogy, Rob, where you're sort of saying it's akin to a personal health scare, because it is kind of that thing. If somebody says to you, all right, I'm sorry, Mr. Willis, but now you've got this disease or whatever, all of a sudden you'll think, right, well, what do I need to do? I need to get better now. I need to be healthier and fitter and all that kind of stuff. And it is like that on a global scale, really. So I guess off the back of this, the question will be, how can you encourage community to continue their thinking, the mindset that they've got now, which is, well, we need to get outside. We only get it once a day, so we better use it up and get as much exercise as we can or whatever. How do we encourage that? How do we encourage communities to do that?
Yeah, I think this whole thing about just getting outside for whatever Mr. Johnson said, get out for one form of exercise for an hour or whatever. It's kind of like quantified self thing, isn't it? Putting a parameter around it. So I mean, it's very much like the behaviour that we see with people with a Fitbit or some form of activity monitor, where they're tracking a function of their activity, like the number of steps taken. So it's kind of all feeding that behaviour, isn't it? Which I think is really interesting. So continue, using the elements of gamification and quantified self like Fitbit does, is possibly how we could see this in a more have more longevity and a bigger effect on population health moving forward.
Yeah, and I think one thing that this sort of situation has created is, when we talk about health and going out and maintaining your health now and the effects that has later on in life, that's obviously a long-term thing, and a lot of people don't really want to think too much about the long-term thing, or they're too focused on the short term. With something like this happening, it's kind of condensed that time frame where we're constantly hearing about people that have contracted this disease and the effects it's had on people that do have underlying health issues compared to people that don't. So I think it's maybe making people more aware that it's not just about the health at that moment, but it's about making them more resilient to things in the future as well.
Yeah, that's a good point, Jamie. I think that links onto one of the other topics we want to talk about today, which is about prevention and preventative health and health maintenance, because clearly we've been given a lot of advice relevant to the transmission of an infectious disease, in this case, which is about social distancing and washing your hands. And obviously there are some examples of people not doing that, and people using the tube, for example. But fundamentally, we're seeing people washing their hands way more frequently than they ever did before. If you go for a walk, you're seeing people walking to the road to maintain 2 metre distance. So that's just one element of how the government has successfully managed to transmit that as a message. But clearly, that kind of preventative action, it pretty much works for every single health health thing. A health condition like metabolic disease is all about physical activity. We have diet. You can take these preventative measures in all sorts of aspects of your health. So it's really interesting to see how we could carry that on and encourage people to be more healthy in the future.
Yeah, and there's definitely certainly an increased monitoring of this sort of stuff. I mean, I know I've been washing my hands like crazy all the time, to the point that they're sore, because I'm almost overcautious of saying, well, they're saying that's what I've got to do, so that's what I've got to do. Now, moving forward, I'm not suggesting that we have to be that extreme our whole lives, but if in any way it encourages more people to just follow those most basic hygiene rules of washing your hands and general social distancing, if you've got symptoms of any kind of illness or you're feeling ill. Rob, on our video call yesterday, you made the point of the best way to get a cold is sat in the doctor's office, and that's an interesting point. Is that same thing of not feeling the need to run straight to the waiting room see the doctor or go see your neighbour. We all do it, don't we, when we've got the sniffles or whatever, and you go around to your families and you say, well, it's just a bit of a cold, I'll be all right, it'll pass. Not really thinking of the consequence of that being passed on, because you don't think of it as a danger, it's something we all suffer with. Then you get something really unknown and scary come along, like COVID-19, which nobody knows anything about. And now we're all like, well, we don't want to pass it on because we don't know what it is. So I guess it's changing the mindset, isn't it? It's getting people to think, irrelevant of whatever's going on, you should always be practicing good hygiene. You should always be considering what the effect is on your fellow family or neighbour. And hopefully off the back of this again, there might be some enhanced encouragement for that to happen.
Yeah, I think there's some really interesting elements of what they're doing in terms of this health communication, in that, okay, over the last months, the message has been relatively garbled and confusing, but they've managed to translate it into something very, very clear now. So it's about looking out for symptoms, which are primarily about fever and cough, and it's looking and taking simple steps, which is stay inside, don't do things that are unnecessary, reduce contact, and all of those things are really easy to understand by people. So this is obviously in the case of COVID, but you could think of any other health condition and give people create a campaign which is very, very clear. Just do these one or two things, and that's going to reduce your risk by 80%, and allow them to track it in some way. And that's the elements of changing people's behaviour and making it easy for people to understand, easy for people to see the benefits, and hopefully see the results of that happening in a reflection of good health.
Yeah, I mean, a lot of this comes down to information, doesn't it? I mean, in all health, when we talk about preventative health, it's normally about understanding, having information. When we talk about, it's 2 days in a row is interrupted.
The cat loves the camera. What can we say?
When we talk about things like, I mean, you said earlier about, when people have a cold and it's like, oh, it's just the sniffles, I'll be fine. And they don't really maybe just take it for granted, because, we do have, medicines and things that can help with the symptoms of those. Maybe, it is about getting the information out there and just having clear information of what you should do and making sure there's no misunderstanding. Because especially when this COVID-19 came about, there's so much misinformation and people not fully understanding kind of the seriousness of it. And I think now having all the technology providers like Google and Facebook and even YouTube, I just went on, they've all got banners on there with information on. It's very clear. It's just like 1 or 2 points. And I think for any illness, no matter what it is, for any disease, that clear information and using the tools that are out there, like these huge technology providers, is a great way to make sure that we do take the right actions in the future for anything else that might come at us.
Yeah. And there's a real opportunity here as well, isn't there, for tech companies, and not just tech companies, but actually all companies, to start developing and thinking differently about what they're putting out. Just in terms of messaging, maybe the way that they look after their own employees, the way the workplace works, how much time they're spending together, how much time they're spending apart. And like those kind of those tools, maybe developing tools to highlight symptoms or highlight good hygiene or whatever. These sound like very basic things, really, but it would be a starting point to diversify your thinking in terms of general well-being of the population.
Yeah, definitely.
Yeah.
I think that going back to that clear message, if you look at the best brands in health are the brands which have very, very clear taglines or consumer messages, like, for example, Nurofen is about targeted relief of pain, Voltarol is about the joy of movement, certain prescription medicines mean certain things to doctors and they prescribe them for those indications. So it's those companies that have shown what their medicine does, differentiated from others with a very clear message, that tend to be the ones that have the best the best results and are the most successful. And this is another case.
Yeah. So another big point then that's moved on to that's definitely highlighted is the area of self-monitoring. So we've talked about this a little bit before, particularly in what's going on in the use of things like Strava or Fitbit or MyFitnessPal or other similar apps, which is all essentially about looking at how our daily lives, how well we sleep, exercise, eat, weight watch, all that sort of stuff. And that whole gamification of trying to stay well, which is definitely popular. I mean, I think you could argue that most of the population globally has some form of connection to these kind of tools. But are the roles of these tools and new tools coming along, just going back to what we were saying before about general preventative stuff, there could be a lot more opportunity there for self-management of health.
Yeah, exactly.
Yeah, I think also there's an opportunity for the tech providers and the wearable providers to take these sort of things into account and maybe sort of add to the offering that they've got. So, I mean, pretty much everyone nowadays has a Fitbit or something similar to monitor the health, but that tends to look at health in the sense of, exercise, working out, eating certain things. Maybe not so much for, giving indications of potential illnesses or things like that. But, with, if we were able to monitor temperature and, cross-reference that with a heart rate, there may be something, these devices may be able to give us early warnings to, you may be getting ill or something. So I think that may be something that could be looked at in the future from those providers with this in mind to give people information on that as well, and not just, the workout routines.
Yeah, exactly. I mean, all of these things are laden with sensors that you can use to translate all sorts of different inferences, particularly around health. So, for example, if you've got a smartwatch has a microphone on it, and that is listening to you all the time, that could potentially be used to count how frequently you cough. It's also taking your temperature. So those are the two biggest indicators of COVID-19. So there's instantly a pathway for that particular disease. So I think that's all really interesting. I was reading something today about South Korea, and apparently South Korea has had an amazing response to this epidemic because they were already planning since a few years ago after MERS responses to this type of pandemic. And fundamentally, they've used technology for example, when people are self-isolating, people have an app, and that app tells the government if you're not self-isolating in the environment you should be self-isolating in. So I know that's a little bit of a punitive, and it sounds like a bit of an invasion of privacy to us, but fundamentally it's showing how that technology in that phone can translate an endpoint that's relevant to COVID. And also in China, I think they're allowing, one of the reasons they've been able to allow more freedom of movement is that they now know people have an app which gives them basically a traffic light system of whether they're infected or not, and whether they're safe to move around or not. So again, another good example of creating freedom of movement using technology that we're all carrying around with us.
We were talking about South Korea the other day, saying that their use of technology, I mean, they were really heavy on the use of technology with dealing with this, and it's also had a huge effect on them. I think one of the things they did as well is they made sure that every time there was a case confirmed, they kind of had like an app which is like a map system, and you could see where all these hotspots were, so people knew to avoid those areas. So just on a basic level of saying, well, we'll get people to stay away from an area where there may be, that infection may sort of that disease may be carried, has obviously had a huge effect on reducing the numbers quickly in that population.
Yeah. I mean, there's definitely some real opportunity, isn't there, in self-monitoring, and we often just talk about kind of the counting of the steps and all that kind of stuff, which is all definitely really relevant. And again, that wider message of generally looking after your own health, which I think is going to be spurred on by off the back of something like this, and hopefully people don't just forget when this pandemic passes. And I think some work needs to be done in that area to encourage that, and that comes down to schools, employers, government, etc. But a couple of key points that I think come out for me are, there's a lot of talk right now about pressure in the healthcare system. And I'm not just talking about COVID-19, but just general things about going to see a doctor, a pharmacist, or whatever it might be. And of course, monitoring yourself is going to help things along immediately, because you can diagnose things a lot quicker by understanding how often you're sleeping, the sort of thing you're eating, how much exercise you're generally doing, what your heart rate's usually like when you're resting. All that information fed to the GP or whatever health professional you're seeing immediately speeds up that process of trying to establish likely causes. So, I mean, we have to do our bit to kind of provide that information, and we've got the tools to do that, So that's one way. The other side of it is looking at things like getting your genome mapped and stuff like that. If we go back to things like 23andMe and we start getting into this very much like predictive health, I mean, I wonder if this should this become the norm for the population. I mean, I don't know if it should be a rule or forced upon or not, but by having that predictive information, surely the strain on any health system is drastically reduced.
Yeah, I think, I mean, we as we talked about before, we've all read the NHS long-term plan for the UK, and our health minister is very, very keen on the idea of how genomics can help people predict and manage their future health, which is scientifically is a very, very valid thing to say. I mean, obviously, there are concerns around privacy, and that's highly, highly sensitive. I mean, data doesn't get more sensitive than any genetic code, but I mean, clearly there are ways of handling this data in a sensitive way, so it's only used appropriately. So I certainly think it's the future. I mean, obviously, there are, in your DNA, there are probably nucleic acid sequences that predict your susceptibility to certain types of infection that could be relevant to this current issue. We know that the microbiome is another issue that relevant and affects our health. So the bacteria that live on us and in us, especially in our gut, they have a massive effect on our immunity and our ability to deal with these kind of diseases and our immune response to them. So, I mean, that science is not particularly well understood today, but as that progresses, all of this stuff builds a really, really powerful picture of our health that can all be assimilated in the digital means somehow. So, yeah, I think the future is really interesting about where all of this goes, not just for infectious disease, but all health conditions.
Yeah, I'm a huge fan of the idea of people having, the whole genome mapping thing and using that alongside wearables and health trackers. And I think it presents a huge opportunity, not just for people to understand the health better, but like you said, Wed, it's for the healthcare industry and for the NHS. Having that information already is a great way to reduce that burden a little bit and get that information quicker.
Yeah. Exactly. I think making this stuff more accessible and more obvious as well. Again, it goes back to messaging, doesn't it? A lot of this comes down to messaging, because a lot of people just don't know about the whole thing of mapping your genome, even through the TV adverts of some companies that are doing it or whatever. It's still quite limited information to the general public. So again, there's more opportunity there for businesses to offer solutions in there, isn't there, in between saying, because you talk about privacy or protecting your data, and it is a very sensitive thing. The health is probably the most sensitive thing you can have. But, actively, we're sharing our data on every kind of platform all the time. And sometimes it's for entertainment. Sometimes it's for, buying stuff or whatever it might be. Yet health seems to have this kind of hidden little dark corner, doesn't it, that we don't really want to discuss it because it's so personal or whatever. Yet monitoring that and having the correct data and information on that is probably the best thing that we could possibly be doing, not only for our own health and our own lifestyles and families, but for the system that's looking after us.
Yeah. I think one thing I know we've seen this as well, and it's kind of a challenge for the healthcare industry, is that messaging. It's that clear messaging. When information does become available for things like this, there seems to be a tendency to focus so much on the science behind it that the clear messaging to the people that are seeing it, that just want to know what it is and what they should do, is sometimes missing. So, I mean, we talk about genomes and things, but if we speak to different people on the street, do they understand the benefits of that, why they should do that? And, you know, I think getting that clear information across, almost dropping the science to some degree and literally just letting people understand why this can help them and what they can do to engage with it, is probably the best thing that some of these healthcare companies and providers can do at the moment.
Yeah, and now's the time to research it, isn't it? I mean, we said yesterday on our cast yesterday that, you know, there's a lot of free time going on right now, you know, and this is the time to start looking at barriers and overcoming those barriers and solutions. Right now, it's all over the news. We can see that there's problems. We can see that there's strain in the world. So what can we do to tackle it? What I do know is that in the UK, for anyone listening abroad, but certainly in the UK, the government are offering money and grants and funds for people to come up with solutions. They're screaming out for it, saying, look, you know, how can you help us? How can you help people that are isolated at home? How can you help people monitor their health? How can you reduce the pressure on the reliance on us professionals having to deal with the problem as opposed to you preventing the problem? And so that's just a green light, I think, you know, for anyone out there to turn their hand to developing some new ideas, I think.
Yeah, I agree. I think what's really interesting about this is the urgency of it as well. So I know like Boris Johnson sort of has been this kind of like his Churchillian moment to come up with some cool sound bites and talk in a statesman-like manner. But clearly there is a parallel between what happened in the Second World War in this country and what's happening now with like unprecedented numbers of people volunteering to help people out, all that kind of stuff. But fundamentally what they're trying to do is fast track innovation to the market. And, you know, we've seen the MHRA, who are the regulatory body in the UK, relaxing their route to getting products that are needed for this COVID emergency to the market without all of the levels of stringency that are normally required. So they're doing everything they can to fast track it. They're giving it to companies like Dyson have been announced as being making as making 10,000 ventilators or whatever it is. So they're breaking down some of those barriers, and I think that's really interesting. In a response to a crisis, all of this stuff can suddenly be lifted, and people can act in an agile manner. So how can we take some of that energy and urgency and bring it to everyday business? So, you know, it's really hard to do projects quickly in large organizations because they don't tend to necessarily act with much of a sense of urgency. So I'd love to see how we can carry that energy moving forward and into our everyday lives in business delivering projects when all of this is over and done with, because that would be a phenomenal thing to see.
Yeah. I mean, well, it leads on nicely to the next topic, which is probably quite prominent for this sector, which is pharma and consumer health. Rob, you've been in this industry 30 years, so you know it well, particularly in the big corporations and how they work. Yeah. And, you know, I think it's fair to say, and we can be quite frank in saying that it takes a long time to develop anything, pretty much, in terms of the pharma industry, because there's so much regulation and hoo-ha going around, and it maybe takes years to get things to market. Yeah. But now's definitely the time for them to be changing, isn't it, in the way that they work? Not only in what they're producing in terms of looking at more digital preventative things as opposed to cures, but two, how quickly they're getting stuff out and how much riskier they are in their workflow. Is that fair to say?
Yeah, exactly. I mean, obviously, we're developing new medicines and drugs. They're obviously very stringent and very necessary safety things that we have to go through to show that the product is both safe and that it works. And, you know, you can't circumvent that procedure in reality, because you've got to show, you can't just bring out medicine and knowing it's not safe. So, and that's why the vaccines are taking, you know, 12 to 18 months to come onto the market. But what you said, Wayne, is let's think about other ways as well of augmenting what we do today. So whether a clinician or a doctor or a healthcare worker or a pharmaceutical company, we tend to think about the way we do things today. So pharma companies should be thinking about how they can impact health without necessarily bringing out that vaccine. You know, do things before obviously deliver the vaccine, but also do other things along the way to control this particular infection, like the examples we talked about in South Korea and China, etc. So it's a case of adapting your approach, and, you know, rather than just sticking to the tried and tested, let's make a medicine, make loads of money under patent, and then it becomes generic. That's a 20-year cycle. We can't. That's no good to anyone. So we need to have that agile way of thinking. To me, it's all about delivering different types of solutions that are appropriate to whatever the health problem is.
Yeah. And I suppose companies like that have to be more open and expose themselves a little bit more to, I guess, what's going on in the wider society, in the tech world, but in the cultural world. I mean, across everything, really. You know, they're very traditionally not just pharma, but like lots of large organizations are very traditionally siloed, aren't they? And we experience this a lot when we work with these companies. And, for the most part, they openly admit that. They say, listen, this is just the structure it is. We're trying to change it. We're aware that there's a lot of disruptive activity going on in the globe. And, we realize that we're not at the table and we're not part of the party. So we want to change that. But with that mentality, that change, you have to make some real active steps, don't you? Take some real active steps to do that. And I'm just thinking of like project teams and the way that they're developing and ideating and things like that. They need to be doing things very, definitely much more agile and in very quick cycles, certainly, or sprints as we use quite a lot, just trying and testing things rather than getting all the way to the end point and then finding it's wrong or it doesn't work. They should, they should be doing it in segments.
Yeah, I mean, as you said, look, we've worked with a lot of companies, and we know some of the cool things you can do to bring some of that culture to your organization. I wouldn't underestimate the difficulty of changing an organization that's been around for 100 years, lots of structure, etc. But there are ways of doing it, and we will see in the next less than 5 years, the companies who can adapt and be more agile and take some of the magic from startups and some of the passion of inventors and innovators and bring that into their organizations. And those are the guys who'll start to accelerate and pull away from the pack of their competitors. But it's not an easy journey, but it just requires a little bit of thinking differently. And fundamentally, it's about the culture of your organization.
Yeah, I mean, I think a big part of that is having a culture that does allow for risk and potentially failure, and being okay with that, and being able to adapt and move on from it. I mean, when we speak to our clients, I think pretty much everyone does say, we want to innovate, we know we need to innovate, and then when we ask, okay, so what are you doing to innovate, the strategy is just, well, we need to innovate, that's as far as we've got, because I think there's that barricade, which is the fear of, but if we don't do it in the way we've always done it and it doesn't work, then are people going to be unhappy with me? Is it going to affect my role? So I think it's getting people to, like I say, think differently, but also be open-minded to try many different things and be a little bit more risky in what they're trying to do.
I think lower the standards a bit as well. I mean, not in medicine, certainly not. But I mean, lower. Well, sounds really wrong now, doesn't it? But I mean, lower the standards in terms of don't expect like such a clinical, high grade, product medical thing that could, lower the science a bit. We saw that. Was it a documentary or whatever I saw the other week where they was talking about doctors, and they were saying like if medical schools would just lower the entry level a little bit, you'd probably find you'd get a lot more, but you'd get better doctors in there, because obviously it's so niched because they only take in this very high caliber based on grades and structure and what they did in their exam that one day at that one time. And actually, if they would just open the net a little bit and let a few more get in there, that would mix it up a bit. And the same goes for companies, doesn't it? If they was to collaborate more with either tech companies or non-traditional people within their sector, they would find that new ideas would come through and they would immediately be working quite differently.
Yeah, exactly. I think your thing about lowering your standards, that there's a thing about that in the sense of how do you let ideas progress? Because what tends to happen in most organizations is they want every I dotted and every T crossed before you even start the project. And that is obviously a massive barrier to innovation, particularly if you're trying to do something that's quite innovative, because by definition, you're not going to have the I's crossed and the T's, the I's dotted and the T's crossed. Yeah, there you go. I've demonstrated it myself. I can't even talk. So if you give people this freedom and autonomy to be able to progress and experiment and fail and learn, then that's obviously the ideal scenario. Obviously, it's all a balance. You need your bankers and your low risk projects to go through, but you need to blend that up with some other stuff as well, and that's a whole massive 20-hour podcast in itself.
Yeah, sure.
No, but I think really what you're saying is basically it's understanding of success and what success looks like to you. And if success is always the same thing and people always see it as the same thing, then that's going to stop a lot of projects happening before they even get going. When really the success should be measured in various things. There should be different levels of success for the projects you're running and what it is that you're looking to do, from something small and something that is a small change but could have a positive impact on someone, to these big radical things. And I think maybe it's being a little bit more open to what you see as a win for your organization.
Yeah,
exactly. And I think that one, as we talk about the good things that might come out of this, and an acceptance of doing things a little bit differently in the future could be a really good thing. I mean, we're already seeing a Conservative government effectively acting like a socialist government by providing a safety net for pretty much everyone in this country. Now, I have to say credit to the current government for doing that, because it's actually quite surprising. But we're seeing them change and adapt their natural position politically to meet the current situation, and that's really refreshing to see. If that can be done at the highest level in terms of the hierarchy of this country, then why can't we do it everywhere else?
Yeah. And just going back to the health point, really. I mean, Rob, you touched upon it a little bit, where you were referencing Dyson and various other companies. But this is happening a lot. These are manufacturing companies. And I guess this is a message to manufacturers out there, or supply chain guys, or people that are really struggling with what's going on right now in terms of how they continue to exist. The ability to change your offer and think differently about what you can possibly do, utilizing the tools and the skill sets that you have in your organization, is there. You've just got to allow yourself to do it. And as we've touched upon already in here, we often don't do that because we're worried about affecting the bottom line or affecting what we're doing. But in times like this, again, there's an opportunity here, because you're already disrupted. So the situation has happened and you're in that position. And now you're already, again, having to think differently about, how do we get out of this? How do we survive? How do we keep ticking when this all passes by? But not to reference particularly on Dyson, but I mean, if you can get somebody who makes vacuum cleaners to be making ventilators, and there's probably 100 other examples of that, then it shows that it's possible. And I think that having that thought process now, because you need to, but actually moving forward at the end of this, is really going to achieve that, increase your opportunity to grow and exist and be disruptive in your market and enter new markets. And going back to the point of healthcare, that's probably the most prominent topic right now. So what can you do in your team with your equipment and your knowledge to help the situation? And we all know what the situations are. People are stranded in their houses. People can't get to work. People can't get food. I mean, everything you see on the news every day should be sparking a challenge. How would we address that in our organization? Why don't you try it? Why don't you get a team meeting with, a few of your employees on a Skype call or something similar, and say, guys, in our organization, how would we address this? What could we do using what we've got? Just as a little test, as a bit of creative thinking. We'll certainly start releasing some information about this, about specific ways you can do this and how you can run sprints. And we're really looking forward to do that. But just as a little idea for you, why don't you look at that? Because the health service, the health industry needs help right now. So what can you do to what can you offer to that? On a just coming to a close, really, but on a quite positive note, the volunteer system is just amazing. I think, the NHS, we said yesterday, the NHS was calling out for 250,000 people to help them out, and in various different areas. And as of recording this now, we're at something like 400,000, I think I saw in the last sort of 20 minutes on the news. That's amazing. That's 400,000 people in the country coming along and saying, what can we do? How can we help? How can we support? Question is, again, going back to that community point, what happens after COVID-19? And how do you keep that 400,000 people saying, what can we do to help? How can we work together? How can we look after each other? And there's an opportunity there for business, do you think?
Yeah, absolutely. Yeah, totally. Set that up. Yeah, keep that going. Totally.
Yeah.
Yeah, I mean, we've mentioned it in the last one of these we did, and even in our conversations with each other, but the community effort when this kind of thing is going on has been absolutely amazing from what I've seen. And I think for any business, it doesn't matter what size you are, what kind of business you're in, and just for individuals as well, that community effort of working together and sort of helping each other through more difficult times is obviously something that, if we can carry that on, that only benefits everybody. So yeah, it would be such a shame if we got through this and everyone kind of just went back to their bubbles and just did their own thing.
Yeah. Okay, well, I mean, on a health front, really, I mean, I think the points are quite clear. I mean, as individuals, we've certainly got a responsibility to be monitoring ourselves and looking after ourselves and utilizing the tools that are out there, organizations have certainly got a responsibility to try and contribute to that in some way, get the message out, make it stronger, develop new ideas, definitely collaborate. There's so much opportunity to collaborate between tech, between health, between industry, to find out new solutions to manage our overall health. And that's in physical and mental health. And there's loads of examples of that going about. And on the wider level, I think, if all organizations are open to the idea of trying to just think a little bit differently, higher their risk a little bit and try some new things, they might find that there's real opportunity in there, and the health market is definitely one key area to look at. So it'd be really good moving forward. All right, guys. I'll close up there. Hopefully there's some nice information in there. As I say, we're going to be uploading these every day. And as we do, we'll get into some more of the actual specifics of what you can do to challenge or take on some of these challenges. But again, as we said yesterday, if you're interested in being part of this, we'd really like to hear from you, whatever sector you're in and whatever type of business you've got. We'd love to hear what you're doing or ideas that you've got. And if you want to come and be on a video cast like this and talk and get involved, then you're very welcome. Just comment in the comments below and come through. Until next time, we'll see you for the next video. All right, guys, take care.
Cheers, guys.
Thank you.
Bye.